Welcome to Brainthropology. Let's talk about our amazing brain and the issues that get us stuck. We all have those moments where life gets overwhelming. It can be related to injury or illness, or an issue with your kids, or just because life is crazy and we need a little help and encouragement. Our team of therapists, expert guests, and clients are here to deep dive into the topics that matter most. We will share information with our listeners that encourages, educates, and empowers.
This episode is brought to you by Galaxy Brain and Therapy Center, helping clients live their best lives by implementing strategies such as those discussed in this podcast. Galaxy Brain and Therapy Center is located in Ann Arbor, Michigan, serving southeastern Michigan for in-person and community-based services. Out-of-state virtual and teletherapy services available for OT, PT, speech, mental health, and mindfulness. Check out their website at galaxybraincenter.com.
Hello, everyone. Welcome to the Brainthropology podcast. We have a great show planned today. Jessica Smith and I are co-hosting a two-part series titled, I Have a Brain Injury, Now What? This is part 2. So if you haven't listened to part 1, you may want to listen to that one first. In our last episode, we went over the team of providers that you may come in contact with after you or your loved one have been diagnosed with a brain injury. Today, we're going to discuss some of the immediate personality changes that you may see along the way, and also the different systems of the body that might be affected after a brain injury. Some of this will be a review, so if you listen to other podcasts of the Brainthropology podcast, as in other episodes, we have broken down various systems of the body. For example, we had an entire episode on the visual system, and we've had an entire episode on the different reflexes and different parts of the body that have been injured. So today we wanted to offer an overview of the information of those who needed it, as sometimes when we get too specific, it can be a little overwhelming, and we really wanted to have a few episodes as a resource for somebody who was just told they have a brain injury or just told they had a stroke or a family member has. We are hoping that this episode will be a nice resource for those who are in immediate need of information after a brain injury is diagnosed. But before we get started, we always like to encourage people to start their day with gratitude. And one way to do that is sharing a personal or professional positive. Jessica, what is your personal or professional positive?
My positive is the people that I get to work with. They are truly incredible. I am lucky enough to call them a work family. The amount of care and compassion and concern that each and every one of them have for each other and myself is incredible. I typically don't work at my full-time job on Fridays, but I was working on a day that, I was quote unquote supposed to be off, and I was not upset. I felt blessed to be with people that love and care about not only me, but my entire family. Like, they ask about my kids all the time, and there's so much genuine care and concern. I feel like I have to pinch myself all the time because it's too good to be true. So I just am so incredibly grateful for how special my work family is.
It's so awesome when you love what you do and you do what you love.
I know.
That's awesome.
Yeah, Debbie, what about you? What's your positive today?
My positive is living in Michigan. So I honestly enjoy every season in Michigan. So even winter, although it might be a little longer than I like, but honestly, I love the cold, crisp air and the beautiful white snow. I do love winter. I also love this coffee cup. So this cracks me up. It says currently caffeinating. It's awesome. I'm holding it up if you're watching the YouTube version of this. So it's the little things in life that I'm grateful for.
Yeah.
All right, so let's get started. So we mentioned that on the last podcast, if you're listening today, don't feel like you need to take notes, as Meg Scaling, the owner of Galaxy Brain and Therapy Center, has put together an amazing guide that's called Where to Start, Helpful Tips for Family Members Caring for Somebody with a Recent Stroke, Concussion, or brain injury, and it's a free printable. So with all the information that we talked about in our last podcast and things that we're talking about today, it's on the Galaxy Brain and Therapy website under the printable tools section at galaxybraincenter.com, which is kind of nice because you can pay attention and you don't need a paper and pencil. So Let's start today by realizing that every brain injury is different. So we really wanted to go over a few of the common complaints and symptoms, but just know that no brain injury is the same. So honestly, in the last 20 years, there's a few things that I think Jess, you and I both have observed, and questions were asked again and again while working with individuals with brain injury about common things. So we wanted to discuss that. So time and time again, we've gotten calls from friends or family members saying that they've either got a concussion or they have a family member that was diagnosed with a mild brain injury or had a stroke. And they ask about what is a concussion, what is a stroke, what is a brain injury, and what to do next. So the whole episode on concussion is available at brainthropology.com. Today, we're just going to go through some, quick overview of the different types of brain injury, concussion being one of them. So if you want an in-depth description, then, go ahead to that podcast, and we'll have a link to that show as well in our show notes. Jess, can you give us a basic description, as I know some of the symptoms of a concussion many times follow the same pattern in most types of brain injuries, although, as I said, every injury is unique.
Sure. A concussion is actually a mild TBI, so a mild traumatic brain injury, and it can involve cognitive changes, vestibular changes, so that feeling dizzy, headaches, visual disturbances, and more. If someone has concussion symptoms that linger, then they may have something called post-concussion syndrome. Each concussion is different, just like each brain injury is different. An important aspect of any brain injury is discussing medications, as they should be used with caution, and you really should talk to your physician and provider about that. It seems like the trial and error approach is kind of standard, but it is important to know that there's something called gene site that can actually help psychiatrists. So it can help your doctor figure out what is an appropriate medication for you if you're needing to take medication. And that wasn't always the case. It's something that's a little bit newer, and some doctors don't actually know that gene site is out there. So it might be something that you want to talk to your doctor. And what it is it's something that can basically see what medications would work with you or your genes instead of just that trial and error approach. So the old way is like, okay, let's try this medication and see if it helps with your anxiety or depression. But the hard thing is those types of medications, a lot of times that trial and error approach, it's like, okay, wait, 6 to 8 weeks. It's going to take 6 to 8 weeks to get enough in your system to see if you have a reaction or if it helps enough. And we have to increase the dosage. And it's like such a frustrating process. And when you're going through the hardest time of your life because of this injury, you don't want this trial and error approach. And so this gene site actually can help you know and understand if you may have a reaction to something.
It's a very helpful test. I've actually had family members have it done, and it's so well organized. You get a report back that specifically says if you will have a minimal or moderate or you're in the red zone type of reaction. And one of the symptoms, the reason the person had this test was they were having suicidal ideation on a certain medication, and they couldn't figure out if it was the medication or if it was their anxiety and depression causing the suicidal ideation. And sure enough, when the gene site came back, the medication that they were on, they had the maximal amount of reaction. So it was in the red zone. Oh. So they immediately went off that medication, and it was very valuable information to have. So it really is a neat way of going about medications.
Wow, interesting to know. Thank you for sharing that, Debbie.
Yeah, absolutely.
Yeah, so advocate for yourself, talk to your doctors. It's good to know what's out there.
Medications are such an important topic to discuss with any injury. Let's talk about some of the other areas that are typical to be affected with brain injury. So one important area that we've mentioned many times, and again, there is a whole podcast on this, but just to give you a few sentences on it, is vision. So with brain injury, gosh, I would say majority of my clients' vision have been affected after a brain injury, whether it's a stroke or the brain was injured in an auto accident. We actually have the vision system is usually affected because there's a blunt trauma to the facial bones, and so they're not aligned correctly. And then other times it's because someone was born kind of asymmetrical, so not necessarily visual that we would be able to see it with the naked eye, but maybe one eye is a little slightly higher than the other. And before their brain injury, their brain could compensate for this, no problem. But after the brain injury, it could not compensate like it did before. So if your loved one has visual changes, and this might present as, you see them walking around and they constantly have a head tilt, or their head is to the side all the time, or when they're walking, you see them kind of drifting to the side. Like if they're walking in a hallway, they end up on one of the sides of the hallway. Or if they complain that reading is difficult, and sometimes it presents as one shoulder higher than the other, there is a chance that they might have something called vertical heterophoria. That is a mouthful. So vertical heterophoria is very common with brain injury. So we encourage you to see a specialist, to get that tested if you see any of those presented. You want to help them find an optometrist that specializes in something we mentioned before called prism glasses and vision therapy. So there's different theories on how to best approach it. So you definitely want to find somebody in your area that specializes in brain injury again. So another area that is almost always affected with brain injury is mood. And I can say 100%, so I've been doing this for 20 years, and I would say 100% of my clients say that their mood has been affected in one way or another. So if the injured person has had like premorbid depression or anxiety or anger issues or some negative personality traits, those traits tend to be exacerbated, so made bigger and worse after an injury. And that's another reason why seeing a psychotherapist or a counselor is so helpful. And something else you might find that is quite common with any kind of brain injury is the filter. So the filter that the client once had, I define the filter as something that to make sure you don't say everything that goes through your head. We all know people that, that don't have brain injuries that also don't have filters, but I'm talking about the person before their injury, they didn't have any issues with this. It didn't negatively affect any relationships. So many times you find after a brain injury that this filter has vanished. So they blurt out whatever they think, whatever's going through their head or whatever they're thinking, and often don't really mean it.
So you might go visit Uncle Joe and, for a holiday, and you go and you say, whoa, Uncle Joe would have never said that before, and know that after an injury, whether it be a stroke, a concussion, a traumatic brain injury, the filter can really be affected. And so that's what Debbie means. It's like, yeah, Uncle Joe might not have said that before, but the filter can really be affected by an injury.
Yeah. And once you have that information and you know that, you can give your family members grace, or you can give the person with the brain injury a little grace, knowing that it's not them, it's their injury. But usually we do see that discernment, judgment, and empathy are often reduced or severely impaired depending on the area of the brain that was affected. And also many times it's difficult with relationship building. So someone that didn't have any issues with relationships, you might find that they're arguing a lot with family members or caregivers after their injury. So the more knowledge you have about this and the more you understand why somebody is acting the way that they are, it really does help. It helps you process this information better and take it less personal.
Definitely.
And so this goes along with something we mentioned earlier about behavior. So Jess, can you kind of dive into that a little bit?
Yeah, often clients need help identifying various behaviors and triggers. And so cognitive behavioral therapy, or sometimes you hear it as CBT, can help along the way with many other strategies. Sometimes behaviorists, or sometimes we hear them called BCBA or board certified behavior analysts, need to be called in to help in situations where clients are in danger or putting others in danger. So sometimes in extreme cases, those individuals also need to go into a rehab facility that can help manage different behaviors. And behavior analysts may need to be called in to help write a behavior plan for the individual. And Debbie, you touched in part 1 on behavior plans. And those can look like certain behaviors such as outbursts or, swearing. Sometimes there's biting, name calling, different behaviors that are addressed in these behavior plans. And it's so that the entire team responds in a consistent manner to the client. Finding a behavior analyst in your area that is familiar with brain injury is really important. Many are familiar with autism, but there's various behaviors that are more prone with brain injury because of the various aspects of the brain that are injured in a brain injury versus autism. So making sure, again, that you find someone that knows brain injury well is really important. And there are companies that specialize in brain injury versus autism. And people with brain injury sometimes become overwhelmed and easily overstimulated. And so when things are too loud, too bright, move too fast, people with brain injuries cannot tolerate too much external stimuli. They sometimes can tolerate it in small doses, but it's hard when family gets together for the holidays or special occasion. And so sometimes what's meant to be happy and joyous and, these occasions that we all kind of get excited about sometimes turn into a scene from a bad movie.
Yeah.
It's hard because these environments have a lot of background noise, talking, they're fast-moving conversations, really unpredictable, and there's commotion, and it's often just too much for someone who's just had an injury or who has an injury. Make sure if you plan to attend one of these events with your loved one with an injury that you have a plan for a quiet place that they can retreat to. And it's helpful if they can pick it. But if they're not capable of picking it, then making sure that you pick it with them or for them is really helpful.
I think too, it's important to, when you're going through this process, know that therapists can help with that as well. So making sure you communicate with your therapist, oh my gosh, John went to this family function last week and totally had an outburst. What do I do? And as a therapist, we can help identify a quiet space or have more of a predictable place when somebody is going to a family function. And that brings me into the topic of unwelcome surprises. So many times after a brain injury, there is a heightened startle response, which is called the Moro reflex. And surprises are just not welcome. It's very scary for somebody that has had a brain injury, sudden loud noises or door slamming. They likely won't like a basketball game with all the horns and the whistles. So there are certain things that will help. And like I said, if you talk to your care provider to see if they're familiar with reflex integration techniques, as these can really help people with heightened and dysregulated primitive reflexes. So they like to know what comes next and to have a plan and schedule for that day. And as a therapist, as an occupational therapist, many times that's what we work on during sessions is we have little grids that will say, okay, from 9 to 10, you're doing this on Mondays, from 10 to 11, and it's predictable throughout the week. And that does help with some of these negative responses to unwelcome surprises. So many times that you'll find with a fluid schedule that clients with a brain injury will really thrive on routine. So make sure that you get your loved one on a set routine and write out a daily or weekly schedule. Sometimes that's the first thing that we do in therapy is get someone a whiteboard and just have that up in a very easily spotted place in the home so they can refer to that throughout the day so they can know what's coming up next. It really does help. So we've talked about some of these psychological things and responses that happen after a brain injury, but there's also a lot of physical. So the physical issues that are present with a brain injury, there's many of them. Jess, can you talk a little bit about that?
So if a person's left side is affected, their left arm, left leg, then their right brain is impaired. So this makes it extra difficult for caregivers because you always have to be on, cueing for safety and monitoring the injured person. They sometimes have a lack of awareness of their left side of their body, and it's called left neglect. They literally cannot see out of the left side of each of their eyes. And so if someone's using a wheelchair, then careful safety measures need to be taken. They can literally crush one of their arms or elbow. I've had clients, run into the door wall or, like the side of doors and just tear their elbows up because they just really don't even realize the left side of their body exists.
It can be quite dangerous. I actually had a client that fell asleep and they had that register heating, so it went up the side of the wall and they didn't feel one side of their body, and without safety measures they actually burned their leg because it was against the register and they didn't realize it. So it's really important to address those issues.
Yeah. So it takes a lot of cueing from family members, and that can be stressful. You also may notice if your loved one is in a coma, they might be moving erratically, and that can be scary, but those are reflexes. And so they're not actually thinking about moving, but they're moving reflexively. And so that's their nervous system kind of moving around. And reflexes are responsible for blinking, breathing, even moving our food through our stomach and intestines. Reflexes are responsible for our protective responses, like pulling our hand away from the stove if it's hot. Reflexes are responsible for if we fall, putting our hands out in front of our, body so that we don't smash our face on cement or curbs.
That's helpful.
Yeah. We like to have that reflex. We don't have to tell our hands to go out in front of us and catch us. It's a protective reflex. And so if your family member is pulling their hand away in that coma, making tight fists, it's probably a reflex kicking in. It can happen if they sneeze or startled, or even if, an emotional response to something happening in the room. If there's not orthopedic issues, you can talk to their physician to see if you can take their hand and gently start stretching it, opening the palm and fingers and trying to get them to relax. It's possible that the reflex has kicked in, but that volitional movement or the movement that they have control over, like being able to move the hand back to a resting position, is not quite working yet. And so you can actually help that piece. So there's a lot of physical aspect that if they've just had a stroke or brain injury, it can be overwhelming, especially if they're in the hospital. But asking, nurses or doctors like, hey, what can I do to help my loved one physically? Because sometimes they can get what we call contractures if they're in a certain position for too long. And sometimes nurses or doctors or even aides are just really busy and they don't have time to kind of sit with your loved one and do the stretches. But if, you ask the questions or to the therapist, like, I'm here, I'm sitting at their bedside, what can I be doing? They can give you some stretches or some things to do with your loved one.
Yeah, that is a great piece of advice. And I think it's important that as therapists, typically we have access to home exercise programs that we can print out. We can print pictures. So if it's a little intimidating, we do have compensatory strategies that can help you as a caregiver get through this phase of the rehab process. So another area that I wanted to talk about after a brain injury is balance. So again, we have a surprise, we have a whole nother podcast on this, but to give a brief overview, because there are significant vision and balance changes after a concussion or a brain injury, make sure you go to a PT or a physical therapist that's certified in vestibular therapy for vestibular and concussion and balance disorders, because the right therapist makes a huge difference. Again, they specialize in neuro and traumatic brain injury. So there are specific protocols that need to be followed, and they're updated every year. So when you see a specialist like this, they know those updates, and it's based on the research on what is working. So there's these protocols that need to be followed, and the reflexes need to be tested in order. There's a certain order that you test them, and also it assures safety when you're training caregivers or family members to be around the person if they're in the hospital or at home. So you want to make sure that that rehab process stays moving forward. So sometimes if a brain injury occurred because of a blunt trauma, there could also be peripheral vestibular deficits originating in the inner ear. So not even necessarily in the brain, but the inner ear. So if you have a loved one that gets dizzy, so as they're walking and they turn their head, you see them kind of reach out and grab something because they feel dizzy, with head turns or with rolling over in bed, make sure that they see a vestibular therapist right away. So if it could be something called BPPV, and surprisingly, if it is BPPV, it can be fixed very quickly. It's there's a certain pattern of movement that you can help the crystals in the inner ear be put back into place per se. It's a lot more complicated than that, but that's just the overview of it. So you really can fix the source of dizziness in 1 or 2 sessions. If it's more of a central brain and cerebellar cause of the balance dysfunction, then that will take a little more work and more time in therapy. But again, we have an entire episode on balance, so if you really want to know the details of that, feel free to tune into that episode, and we'll put that in the show notes as well. So another area that I want to make sure that we dive into, which is so important, is sleep. Jess, can you give us some kind of an overview on sleep after a brain injury?
Yeah, so people with brain injuries often cannot sleep well anymore. I would say in the numerous years, I won't age us.
Don't age, please don't age us.
In the numerous years we have been working with people with brain injuries, I don't know if we've even had 1 or 2 people tell us that their sleep patterns didn't change for the worse. Almost always the people tell us, I can't sleep anymore. Sleep hygiene is something as occupational therapists that we always do, and we help.
So some might know what sleep hygiene means. So sleep hygiene is simply digging into having the client identify what their structure is to get to sleep. So we might ask them a series of questions. What are you doing an hour before you go to bed? And if they tell us, oh, they're on screens and they're doing something exciting, we may adjust that hygiene and that schedule to involve more of meditation, making sure that an hour and a half before you go to bed, you get your pajamas on, giving your brain a cue that it's time to wind down, not using screens and things like that.
And actually, it's really helpful. There's been research too that you train your brain. So if you do 1 or 2, ideally at least 3 things before you go to sleep, so brushing your teeth, 10 minutes of reading, and even putting lotion on, or like a set series of at least 3 things before you go to sleep, your brain starts to know, like, oh, she brushes her teeth, she reads, she puts lotion on, like this means I'm supposed to go to sleep, so your brain gets used to, they say the same thing with children too. Like if you have a sleep routine, like a get ready for bed routine, that your brain starts to know, like, I'm supposed to be getting ready to wind down and go to sleep. So
yeah, that's great information.
Yeah. And, reducing screen time and all of that. So it's good for family members to kind of all get in that routine of getting ready for sleep. The interesting thing is, even though it's harder to sleep, the brain needs more sleep after an injury for, getting better. And so 8 to 9 hours is an ideal range for
absolute
sleeping.
minimum, though.
Yeah, minimum to sleep after brain injury. Covering lights and alarm clocks and using blackout curtains is all really helpful to really kind of create a good sleep environment.
And what happens if somebody doesn't get sleep when they have a brain injury?
Yeah, so a sleep study may actually be necessary. There's something that is called central sleep apnea, and so your brain injury can create sleep apnea. So you may need a sleep study to figure out, all of the ins and outs, and you may need a CPAP, which is a machine that you may have to put on at night to help you get more oxygen and ensure better sleep. So especially if you're waking up feeling tired, you may not be getting enough oxygen at night and you may need that CPAP. So anyways, so that's what a sleep study would figure out. So there's also something called neurofatigue, and this happens after brain injury or concussion. And it's different than just typical fatigue. Neurofatigue is, just this extreme brain tiredness. And it's a huge factor in brain injury recovery. There will be good hours of the day where the injured person is at their best, and there's times of the day that they're just really mentally and physically exhausted. It's a different level of exhaustion. Like, they really can't just pick themselves up and keep going. Be mindful that there really only are so many energy points that they'll have in a day. And if they use them all up in the morning by taking their shower, getting ready, there may not be any energy left over for the doctor's appointment that they have later in the day. Make sure that, the person that has a brain injury is planning daily activities carefully. Maybe showering the night before is a good strategy, before the doctor's appointment, so that they have enough energy to safely get to that doctor's appointment to and from. So we actually have a really good, Debbie and I did it.
It's one of my favorite episodes.
We're going to say this for every single thing, but we have another podcast on this. Debbie and I did a podcast on this topic. It's called
Energy Conservation.
Energy conservation, and we talk about the spoon theory.
Yep.
And basically, you only have so many spoons in a day. And so when we talk about you only have so many energy points in a day, the person really only has so much energy in a day. And so we won't get into the whole spoon theory now, but
you can YouTube it though. There's so many videos on it. And actually on Brainthropology.com, we did a blog on it.
Yeah.
Which is, it's interesting.
And we actually link, I think, the blog to the show notes on this episode as well. So
yeah, it's basically if you have 10 spoons in the day or however many, and you wake up and you take a shower and it takes 2 spoons away, and you have breakfast and that takes 1 spoon away, and you go for a walk that takes 3 away, how many are left for the day? So it's a neat concept at explaining to people how much energy you have.
Yeah. So Debbie, we've talked a lot about the symptoms and things. Let's talk about one of my favorite things, and things that really kind of help someone once they've had a brain injury or stroke or concussion. And you get to start with, again, one of my favorite things, which is whole brain exercise.
Yes, it's really the premise of the type of occupational therapy that Jess and I do. So what is whole brain exercise? So it's basically a variety of activities that aids in stimulating the growth in different areas of your brain after a brain injury. So many times we stimulate multiple areas of the brain simultaneously during therapy, and that gives clients appropriate physical, auditory, and visual activities at the same time. So an example would be if you're sitting in a chair and we're having you do an exercise we call cross crawl. So you have your hands up and you're crossing the body, touching your knee and coming up. and then with the other hand, crossing midline and coming up. And we use rhythm and timing. So we may have a metronome going and you're doing it to the beat. And then all of a sudden we add a visual component and an auditory stimulus. So for example, we'll put the TV on. And it's really interesting because research supports that it makes a huge difference in physical abilities and cognitive abilities as we start to desensitize the brain to these multiple system challenges. So it's really interesting. So you really want to try to find a therapist near you that understands it. And then you can take continuing education courses as well and do it with your family member. So there's a lot of different classes around. I've also found if you Google whole brain exercise online, obviously talk to your doctor first, but many helpful videos pop up that are really educational. So if you've become kind of the lifeline for your family and you really want to learn more about how you can be a whole brain trainer for your family member, there's resources that will help you tremendously. So the classes are fun and it'll kind of open up your mind to new possibilities of retraining your brain. So there's different classes you can look up in your area. Some of the main ones that I think we've become familiar with are Balavizics.
I'm gonna do a quick shout out to my favorite trainer, Katie Held.
Oh, she's amazing.
I am gonna link her website on the show notes. She does a ton of training. If your loved one, she does some elderly classes in the Ann Arbor area. And she does some seated. She does individual classes too, but she does some training too. So if you want to become trained to help your loved one, she is amazing.
Awesome. That's a good resource.
Yeah, she's a good resource. So.
Excellent. So if you wanted to pursue classes, like Jess said, she'll link that on the website. So some of the most common that we've heard of that we use, Brain Gym, MNRI, and also Galaxy Brain and Therapy offers training, and they integrate the whole brain exercise into their therapy program. You can always call or look on their website for information as well. And we'll put all that information under the show notes. Another area that we kind of touch base on a little bit, but alternative therapies. So there's so many different alternative forms of therapy and not enough time or space to discuss them all. But one of our favorites for brain injury is called cranial sacral therapy. It can be performed by a massage therapist, an OT, a PT, and it's been extremely beneficial for many of our clients. It relieves pain and headaches and improves cognition and reducing anxiety as well. So it's a form of, it's a gentle therapy. It involves improving cerebrospinal fluid movement around the brain. And I've had it done and it's very relaxing. And it helps a lot. So another favorite is massage therapy. It's helpful for relieving muscle tension and pain. A lot of times after brain injury, as we mentioned before, there's physical injuries. So tight muscles and, it's uncomfortable. And sometimes massage therapy relieves that pain. Also, mindfulness and meditation are effective. So this has actually become more prominent in the news and research lately. And there are so many research studies that show improved brain function, decreased anxiety. And these are physiological factors. I mean, they are measured that it really does decrease anxiety if you're involved in a mindfulness and meditation practice. One particular program that Jessica mentioned earlier is called Love Your Brain Yoga. So it's a low cost or free yoga program for people with a brain injury. And you can go on their website or you can go on our website, Galaxy Brain and Therapy Center. And in the show notes, we'll actually link information about this, but it's a low cost or free yoga program. Acupuncture also really helps with pain and inflammation. So you can find a highly trained individual, really create the foundational skills for movement with acupuncture. So after you have acupuncture performed many times, that increases your ability to move and decreases pain. So I know that's a ton of information, but remember to check out that printable, also the show notes, as it's all written down so you can search for more information on it. But before we start to wrap up, we should probably address the word discharge. So Jessica, can you talk a little bit about this?
Yeah, and just because your loved one is just discharged does not mean they're done getting better. keep at it. We will add a link to the show notes on a really informative blog post on Plateau for motivation to keep going. Sometimes your therapist is just out of their bag of tricks, but keep going. Not all therapists are alike, and there's also a time and place to rest and just to take time off of therapy. Last time I checked, people in college take the summer semester off. Why? Not because they don't have the capacity to keep going, or they're done with classes, but because they just need a brain break. People in rehab may also need some time off and some time to do the tasks that they learned more efficiently, faster, with less effort before they move on to their next big goal. So there's, that rest, recharge, and then you can join back to therapy again. And then there's, the legal piece, the not so fun that we should probably address too, right, Debbie?
Yep.
So sometimes there's times that we need to get an attorney involved, and especially if it's an auto or a workman's comp related injury. And just make sure you know that every conversation that you have with an insurance company is most likely recorded. If you think your insurance company is going to deny payment for services, it's important to get an attorney involved. Some attorneys may want you to settle and waive future benefits. So just make sure that you know what is in store and
know they're experienced in brain injury cases as well.
Yeah, and just make sure that you ask your physicians, attorneys that are good, and
do your research.
Don't be fooled by the late night injury attorney with advertisements that promise you millions and millions and millions of dollars, because unfortunately that's not typically the case.
There are good ones out there, we promise.
Yes.
We've worked with many of them.
Yes. And then one more thing to mention is disability. So you or your loved one may qualify for Social Security disability. We did an entire podcast on Social Security disability, but just know that nearly everyone gets denied the first time that they apply. Plan on reapplying, fighting it. There's a ton of resources out there. We linked them all to our disability podcast. So know that podcast is out there with those resources linked. Michigan Rehab Services is a resource, and each state has programs for people who want vocational training to get back out there. But again, we have that podcast that takes you step by step through that. So just know that that's out there.
That is very important information. So before we close, there's just a few more really important topics that we wanted to cover. One of which is, I don't think people realize the importance of moving forward and giving back. So I want you to think about what it would be like to need help from others for everything. So think about the need to be supervised, to be cooked for, toileted, and driven around, what it would feel like not to be your own guardian and to have decisions made for you, and what it would feel like if you couldn't be left alone and your loved one, you were stuck in your own home because of your injury. So what would it feel like to constantly be working on your memory and going to therapy and, working on your arm that doesn't work, or your fine motor skills, your balance, and working on you, and everything's about you. Many clients have shared with us that sometimes they do feel like a burden, and it breaks our heart when we hear this, but it is a reoccurring theme. At some point, the injured person becomes so sick of working on themselves, and we can't stress enough as therapists how important it is to find ways for them to give back. So I know this sounds like an oxymoron, because yes, you want them to work on themselves, but if they need to work on fine motor skills, have them tie a blanket that they can donate to a local humane society or a hospital. If they need to work on cooking skills, have them bake cookies for a friend, or if their goal is improved endurance, have them rake a neighbor's yard. And obviously, this is all what they're capable of doing, but help them think of ways that they can contribute to society and be a part of helping others. I can't tell you stress enough that this will help build self-confidence, elevate mood, and help the person feel like a productive member of society, which is so important in the recovery process. So I want to end the podcast on a positive note. So I firmly believe in the power of positivity. In fact, my hobby is actually studying positive psychology. My friends are probably so sick of hearing about all the research studies about it.
Not at all. Debbie is our positive sunshine.
Oh, thank you very much. I do love my smiley faces, my yellow smiley faces. But there is so much power in positivity and gratitude. So starting the day with gratitude makes such a huge difference in the healing process. It takes so much work recovering from a brain injury, and positivity needs to be something that everyone tries to keep alive. There are days that this does not seem possible, and we get it, but just do your best to stay positive and help the injured person stay positive too. So little things like you could leave a little sticky note, in the bathroom saying, "You got this, great job," or a smiley face, or a little note in their therapy bag that when they go to therapy, you can do it. But honestly, hope and positivity, it helps us thrive and it keeps us moving forward. Another thing is gratitude. So there is so much research on the power of gratitude. We actually try to incorporate this in therapy where we work, and there's a neat 21-day gratitude challenge that we encourage our clients to do. We will post a link for that. It's super easy. It's just a little printable, and a certain amount every day you write down what you're grateful for, and it just gives you a different mindset. And honestly, there is research that supports this data, so we encourage you to check that out in the show notes. We hope this information helps you gain some perspective and knowledge to help you be the best advocate for your loved one. We also hope that you use the tools and the resource on the Galaxy website and all the amazing websites out there that dedicate their time and energy to helping people. And we specifically helping people with brain injuries. We are all in this together. We are here to help you. There are therapists that can even provide training through teletherapy platforms. And so overall, we want you to remember, number one, select a team of expert professionals, really that specialize in traumatic brain injury. 2, learn about brain injury. Knowledge is power. 3, find a support group or network. And 4, encourage and be encouraged to stay positive. If you found it helpful listening to this podcast or think any of your friends or family would benefit from hearing it, please share this episode. Feel free to check out other episodes at Brainthropology.com. As always, we encourage you to be courageous and move forward in your day with hope, joy, and purpose.
While we love what we do and are as passionate as they come, the information on this podcast and discussion is for educational purposes only and should not replace professional medical advice. Please consult your own healthcare provider if you are seeking medical advice, diagnoses, or treatment for you or anyone else. We do our very best to provide correct information, but please understand science and medicine is ever-changing. We welcome feedback, comments, suggestions, or correction of errors. This disclaimer applies to any guest or contributors to the podcast or blog.